So I'm just going to give a quick overview of the needs and the challenges of evaluating hospital rooms projects, and then Nicola will go into more of the specifics of the framework that we're currently developing at Northside House. So as you've seen and heard from Tim and Neve, our projects and artists radically transform spaces. And really at the centre of what we do is building this close working relationship with patients and staff who have daily experiences of these environments and therefore can give the most valuable insight and critical feedback. It's really crucial to capture this, not only through understanding the impacts our projects have on the environment, but also through the individual subjectivities of patients and staff. So evaluating in this sense allows us to create a continuous feedback loop in order to improve our processes and curate our projects with acute awareness. So Neve briefly touched on this, but just to go in a bit deeper, our workshops are a vital part of the project. They're an opportunity for the artists to work with the ward community and to get a sense of the environment. And as you can see from the images, they vary greatly from life drawing with owls, printing with squid ink, wax rubbings, t-shirt painting, and often the finished work that comes out that the artist makes for the ward is directly or indirectly informed by these workshops. For me as a hospital rooms team member, working with patients and staff on these projects is incredibly rewarding because of how clearly we can see relationships building between the artists and the patients and staff through creativity, creative processes, and the nuances that come out of this experience. But these things can also make evaluating and capturing and recording these moments as data much more complex. So we facilitate workshops in a variety of different mental health settings, from psychiatric intensive care units to mother and baby units, and therefore the needs and requirements of those participating differ from project to project. Is something quite different from community engagement in a gallery, for example. And in the past, we found that using standard arts evaluation tools can be quite inaccessible with questions that aren't very applicable to patients doing the session. A multiple page form can also inadvertently dampen the excitement that's been generated through a session. So in evaluating our workshops, we require tools that are inclusive and accessible and that don't detract from the experience people get from participating in the workshops. So what we're aiming to do through our collaboration with NUA and with Northside is to develop a robust methodology that's workable across all of our projects in order to create a gold standard for evaluating creative projects in mental health units. In previous projects, we focused on qualitative methods, so things like reflective diary entries, first-hand observation, semi-structured interviews and questionnaires. And we're now at a point where these are becoming an essential component of our project process. So these methods, especially interviews, allow for in-depth exploration, and we found them to be really significant in the hospital rooms narrative. For example, something that came out of an interview with a psychiatrist of a project in 2019 was the correlation between the perception of time and effort spent on an artwork made for the unit by a world-class artist and an increase in patients' sense of self-worth. But alongside these qualitative methods that are more directed towards individual perception and that often happen at the end of projects, it's really important to create comparative data that allow for a wider scope within hospital rooms and then that can be transferred to other arts projects in similar settings. So something that we're developing at Northside and that Nicola will touch upon is the idea of mapping spaces before and after the artworks are created for the wards to observe whether there are changes in movement, behaviour, congregation, as a way of sort of having more quantitative data to back up our qualitative research methods as well. This is the last bit for me, but going back quickly to what I mentioned earlier about the need for inclusivity, we've recently started using this form that you can see on the screen now at the end of workshops at Northside, and it's proved to be really successful in creating a balance between self-expression and accessibility. So it was developed from the traditional arts obs scale, but instead of using it as an observational tool that is recorded by us, patients are able to identify how they felt before and after the workshop and write any other comments that they might have. And I think the sort of playful elements and the way people can relate to the different expressions of emotion make it much more inclusive than other tools that we've tried in the past. So in terms of the needs and challenges, one last thing I want to mention is having the time and resources to evaluate effectively. And something that I found in recent workshops that I've facilitated at Northside is that having dedicated team members and ward staff who are responsible for doing things like the reflective diary entries or ensuring that patients have the opportunity to express feedback is really paramount to the process. So this seems like a good opportunity to pause and hand over to Nicola, who is collaborating with us and supporting us greatly on developing this methodology. So Nicola, over to you.
Thank you very much, Phoebe. A lot of what I'm going to say is actually just going to echo what Phoebe's just said, but I thought before I go on to talk very briefly about the evaluative design Norwich University of the Arts has been working with hospital rooms and Northside House, I wanted to just mention some of the wider contextual challenges to evaluation that this project has been facing, and many other projects in the sector too. In a recent conversation, 36 leading UK-based art practitioners and evaluators and researchers, including speakers from ACE, Arts Council England, and the Culture, Health and Wellbeing Alliance, met to discuss the challenges of evaluating creative practice for health and well-being in the pandemic. It was noted that the current COVID-19 global pandemic had accelerated the need for collaborative and co-produced approaches to evaluation, and that there had been a noted shift from quantitative outcomes evaluation to qualitative impact and process evaluation. 4 key challenges were outlined: a lack of time and resources, concerns around rigour, ethical worries around including but not burdening participants. And all of these 3 concerns have been greatly exacerbated by the strain COVID-19 has placed on healthcare environments and staff wellbeing and morale. So Norwich University, with these challenges in mind, has been collaborating with hospital rooms on the Northside House project in the development of a model for sustainable evaluative practice that translates effectively, initially from one hospital rooms project to the next, and then further afield across other arts, health and wellbeing sectors and projects. In effect, we're trying to support hospital rooms in addressing these challenges, but particularly the lack of time and resources in the process of evaluation for projects like this. So thank you, Phoebe. Can we go back to the previous slide? Sorry, perfect, thank you. So in considering some of the personal outcomes for the service users and thinking about some of further evaluative questions, we've come up with these aims. Can we improve the measurement and documentation of the subjective impacts of participation in an arts project by patients at Northside House? Does participation in the arts project lead to a change in wellbeing scores among participants? Can we improve measurement and documentation of the subjective impacts to patients from changes to the environment through the artwork installation? And do changes to the environment through the artwork installation lead to changes in wellbeing scored among participants? Next slide, thank you, Phoebe. Because of this, one of the challenges outlined in earlier, the ethical worries about including but not burdening participants, previous projects and evaluative data collected by hospital rooms has led to, there's an enormous of rich data actually to do with the effects on the environment and the effects on staff too. So what we've tried to do with this project is embed those kind of outcomes into our evaluative questions, and very much focusing not just on the outcomes for service users, but actually the outcomes for staff and the environment. So we've come up with some of these questions. What effects of the project on communication between people within the workshop settings can be documented? Can we measure and document any effects from the artwork installations and what these have on the communication between people on the wards? And this is a particular interest of ours. What are the subjective impacts of participation in an arts project on staff at Northside House? And again, this is really interesting because a lot of the data from the workshop show that there is as many staff participating in workshops as there are service users, and we're trying as much as possible to see how that engagement by staff improves their well-being. Does participation in the arts project lead to a change in wellbeing score, among staff? Can we measure and document any subjective impacts to staff resulting from the arts installation and changes to the environment? And do these changes to the environment lead to a change in wellbeing scores among staff? Can we go to the next slide, Phoebe? Thank you. So as Phoebe mentioned, one of the ideas we have is looking at mapping the spaces pre and post the installations of the artwork. And why we've come up with this idea is there is a lot of data that has come from these semi-structured interviews and testimonials from patients and staff from previous projects about the changes to the environment and how that changes their behaviour. I'm just going to read 4 of these anonymous comments from a recent project Hospital Rooms did with the Ellen Skellen project, a psychiatric intensive care unit in London. I was going to say, there is this serenity about it. They like to sit around that table, sitting in that table and chatting. It feels like sitting around in a park. It's soothing and relaxing. I was really relieved to hear people just sit and contemplate the art in the forest, because I sometimes do that too. I come into this family room when my thoughts are racing. I have on a couple of occasions taken a couple of minutes or even seconds to get that respite from the ward and from my thoughts. It's really nice. And that's a comment from a staff member. Since the artwork is up, we've had less acuity, but we don't know if that is the art. There are so many things that it can be, but it could be part of it. I really like how the different areas have a different character. They're now separate spaces with their own feeling. When you move to different ones, you get a different sense. Before the ward, it just felt like a ward, one big space. So comments like this are really not the exception at all. And as Phoebe has outlined, many of these comments come from the qualitative research methods used by hospital rooms, such as the visual matrix and semi-structured interviews. However, almost all that data is gathered post-installation of the artwork. So what we're going to try and do is to work out with Northside House project is work on the feasibility and practicality of carrying more data gathering before the artworks are installed. We're going to introduce this notion of behavioural mapping and try and look at how the staff and the service users move around the space before the installation of the artworks and afterwards. We're going to try and record physical and social behaviours in various functional, transitional, recreational zones post and pre-installations of the artwork. And Phoebe and I are very excited actually that we're going to be able to start this next Thursday, hopefully at Northside House. And again, it goes back to one of the challenges at the beginning I mentioned. This is only possible from the really goodwill of the staff at Northside House, and particularly Jed and the other members of the staff on Catton Ward. So great thank you to them for that. Okay, thank you.